Well, good afternoon again, everyone. My name is Heather Ansley. I'm the Associate Executive Director of Government Relations for Paralyzed Veterans of America. And we want to again welcome you to today's webinar on understanding VA's Veterans Transportation Program. Our presenters will be Roscoe Butler, who's one of our Associate Legislative Directors, and also Michael Yaskowiak, who is one of our Senior National Service Officers. Before we jump in today, we wanted to let you know that the webinar is being recorded and will be available for viewing later. Usually takes about a week or so on pva.org. We will have a recording of today's webinar along with the PowerPoint slides available for you to take a look at anything you may have missed. We do also have closed captioning available for today's webinar. And if you click the CC button in the middle of the meeting controls bar that's at the bottom of your screen, you can turn that on. Also, if you have a question, we ask that you would type that into the Q&A box instead of the chat box. So again, please use the Q&A box that you will see again on your screen, and we will hold questions until the end of today's presentation when we will have time for Q&A. So without further delay, we're going to jump in and get started. So I'm now going to turn it over to Roscoe Butler, and he is going to take it away. So Roscoe, if you could please get us started on today's webinar.
Thanks, Heather. Good afternoon, everyone. During today's webinar, we're going to take a deep dive into the VA's Veteran Transportation Program, and you'll get a brief overview of the components of the program. And then we're going to have a dialogue with an NSO with some few questions. We'll talk about any pending legislation that will impact this program. And then after that, we'll get a brief question and answer session. Next slide. So the VA Veterans Transportation Program is broken down into three specific programs. The Beneficiary Travel Program, which was enacted under Public Law 85-857, and it's been around since September 2nd of 1958. Then we'll talk about the Veterans Transportation Service, which has been around for a number of years, but not as long as the Beneficiary Travel Program, and then the Highly Rural Transportation Grants Program, which is a newer program as well. Next slide. So let's talk about the Beneficiary Travel Program. As I said, it's been around since 1958, and the program is designed to reimburse eligible veterans for costs incurred when they're traveling to and from a VA healthcare facilities. Dating back, as far as I can remember, the program mileage rate was at one time 11 cents per mile. And since over the years, the rate has increased to 41.5 cents per mile. Beneficiary Travel also provides pre-approved transportation and special mode transportation at VA's request. Veterans may also be eligible to travel by common carrier, and VA defines common carrier as a bus, train, airline, or taxi under certain conditions. Next slide. So what are the eligibility requirements for beneficiary travel? Any veteran who is traveling in connection with treatment or care for a service-connected disability, a veteran with a service-connected disability rated at 30% or more, a veteran receiving a VA pension, a veteran not traveling by air and whose annual income does not exceed the VA maximum annual pension rate, a veteran or other person who's traveled to or from a VA or contract facility and travel is medically required to be provided by a special mode of travel. And on the previous slide, we defined what special mode of travel is. And a veteran who traveled to a VA or contracted facility for a scheduled compensation and pension exam. Next slide. And this was the most recent change, and this change came about due to the tireless effort of two VSOs, PVA and the Blinded Veterans Association. They lobbied before Congress and got Congress to authorize beneficiary travel for a veteran with a vision impairment, a spinal cord injury or disease, or a veteran with a double or multiple amputation whose travel is in connection with care provided through a specialized disability rehabilitation program of the VA, such as an SCI center, a blind rehab center, VIS program, and a prosthetic rehabilitation center. However, this program has some limitations. The veteran must be traveling on an inpatient basis or during a period in which VA provides the veteran temporary lodging at a VA medical center. Of note, we are looking into whether or not we can expand the program to include outpatient care, but I can tell you based on the research I conducted, at the time this was authorized into law, Congress did not want to make beneficiary travel available to all non-service connected veterans who meet this criteria. Therefore, they limited it to the two criterias that I discussed. And so if we pursue expanding it to outpatient care, it's going to be an uphill battle. But we've had veterans come to us and ask that question: why can't I get it when I'm traveling on an outpatient basis? Next slide. Okay, so when must a claim be filed for beneficiary travel? You have to file a claim each time you complete an appointment, and the claim must be submitted within 30 days of the appointment. So, and if you're not eligible at the time of your appointment and you become eligible after the appointment, you must submit the claim within 30 days of when you became eligible for beneficiary travel. Next slide. And we get a lot of questions about, how do I file a claim for beneficiary travel? There are two ways you can file a claim. First, online by completing VA Form 103542, beneficiary travel claim for reimbursement of travel expenses, and by completing a paper form, VA Form 103542. And you would submit the form to the VA healthcare facility where you receive your care. And below is a link of where you can download, how you can download the form. Next slide. So let's talk about veterans transportation services. As I mentioned, this is a somewhat a new benefit. It's been around for maybe 9 years or so, but this benefit provides safe and reliable transportation for veterans who require assistance traveling to and from a VA healthcare facility and authorized non-VA healthcare appointments. It allows local facilities to hire drivers and purchase vehicles to transport veterans to their appointments. And it also has established a network of transportation options for veterans through joint efforts with VA's Office of Rural Health and organizations such as veteran service organizations, community transportation providers, federal, state, and local transportation agencies, nonprofits, and veteran transportation community living initiative grantees. This is a grant program where the VA has to apply for the program, and if they are authorized and approved for the program, then VA will furnish the medical center with vans to transport veterans. The medical center then should hire a mobility transportation coordinator, and that mobility transportation coordinator is responsible for coordinating the transportation needs of all veterans traveling to and from that facility. They will oversee the DAV transportation vans, the VTS vans, and community transportation services that services that local VA medical center. Next slide. So who is eligible for VTS? Any veteran who is eligible for VA healthcare benefits and has a VA authorized appointment is eligible for transportation through the VTS program. Participating VA medical centers offer VTS to assist veterans in accessing transportations to medical facilities or authorize non-VA appointments to receive their care, such as the VA Community Care Program. Next slide. So how can you find a local VTS? You can reach out to your VA medical center and ask to speak to your local mobility coordinator or the VTS coordinator. Also, at the end of the slide presentation, there's a resource guide, and if you go to the slide, that it provides a list of VTS locations. Next slide. So the Highly Rural Transportation Program. There are approximately 108,095 highly rural veterans enrolled in the VA healthcare system. 30.5% of highly rural veterans served in Operation Enduring Freedom and Operation Iraqi Freedom. And 2.1 million veterans who use the VA healthcare facilities are living in rural or highly rural areas. That's a lot of veterans. VA has approximately 8 to 9 million veterans enrolled in the system. So 2.1 million is a significant number of veterans living in rural or highly rural areas. Next slide. The Highly Rural Transportation Grant Program also provides grant funding to veteran service organizations and state veterans agency to provide transportation services. Veterans, these organizations annually, VA will advertise in the Federal Register when service organizations and interested parties can apply for these grants. And once they apply for the grants, they're evaluated. And if approved, they will be awarded a grant to serve their surrounding VA facilities. And there is no cost for veterans to use the transportation provided by the Highly Rewarded Transportation Grants. And again, at the end of the presentation, during the resource guide, you will find a link that is titled HRTG Grantee Locations Near Me to find a grantee in your local area. Next slide. So Michael and I are going to have a brief conversation that hopefully will be of some service to you. How you doing, Michael?
Good, how are you?
I'm doing great. So we get questions all the time. So if I have a veteran with a transportation issue, who should they contact?
They can contact their local PVA NSO, and what we can do is link them up with their local coordinator or point of contact for whichever service that they're looking for, like Beneficiary Travel or VTS. And we can let them also know if there's a highly rural transportation grantee in their area. We can provide the link for them to look themselves, or we can even look it up for them and give them the contact information of that person at their local VA medical center.
Thanks, Michael. So if I don't know where a NSO resides in my local area, how do I find out to get in contact with an NSO?
They can go right to www.pva.org. In the top menu bar, they would scroll over Veteran Services and then scroll down to Find a National Service Officer. That will take you to another page where you can click on Find an NSO, and you will enter your city in the block, and it will pull up actually VA medical centers, PVA chapters, and service officers in your area.
Great. And what happens if I apply for the Veteran Transportation Program and my application is denied?
You can also contact your local PVA NSO, and they can assist you in preparing and submitting an appeal. Travel benefits would be considered a health benefits appeal, so that's ultimately under the jurisdiction of the BVA. This is a little different than a clinical appeal that you would think would happen at a VA medical center, but this is actually a benefit, so it's a health benefits appeal, and your PVA service officer can assist you in preparing that and submitting that to the VA.
So in the interim, while my appeal is being processed and I'm told I'm not eligible for the benefit, are there other resources available to me to assist me with transportation?
This is going to depend on the location, but I would point them to their local county Veteran Service Commission. Sometimes they provide transportation. Their local veteran service organizations may have their own independent program, and there could also be community providers or something through the city that offers transportation.
Okay, and I'll also add that through VA's voluntary service, you can reach out to voluntary service, and they have non-appropriated funds donated dollars. The service organizations donate millions of dollars through the volunteer service, and they often can assist veterans with transportation as well. Thanks, Michael. Any other questions or any other information you can share about the VTS program that would assist veterans?
Any other information as far as the program?
Yes.
I would just tell them to go to the resource slide that's going to be provided at the end. It has lists of where to find your local point of contact. These grants aren't available in every area, so you'd have to find if it's available in your area. And also, just if there's anything in doubt, just reach out to your local PVA NSO and we can point you in the right direction.
Thanks, Michael. And also add that, if the grants are not, the VTS or the highly rural transportation grants are not available in your area, you can advocate in your local area to your medical center to work with a VSO or transportation services to offer those grants. Thanks, Michael.
You're welcome.
Next slide. I want to talk about a piece of legislation that is currently being considered that would improve access to transportation for veterans. It's the Rural Veterans Travel Enhancement Act of 2021. And if enacted into law, it would make the Veteran Transportation Service program permanent. Right now, it expires every year and Congress has to go in and extend it for another year. It would also make VA authority permanent to provide grants to veteran service organizations and state veterans service agencies for assisting highly rural veterans travel to a VA healthcare facility. This is another one that expires annually, and Congress has to extend the law each year. Lastly, it would direct the Government Accountability Office to conduct reports on any fraud, waste, and abuse of VA's Beneficiary Travel program and the effectiveness of the program, current mileage reimbursement, and deductible amounts in encouraging veterans to access care. You wouldn't believe it, but when the mileage rate was increased to 45 cents a mile, there was a lot of reported fraud in the program. The OIG, VA OIG did several audits of the program where unfortunately people were giving falsified information to draw funds that they would not have been eligible to receive. And that, the impact of that is taking away money from a program where it can be spent or used to provide benefits to those veterans who are otherwise legally eligible for the program. So I'm assuming that that's why the Government Accountability Office has been asked to look into this and to come up with a solution to ensure that only veterans who are eligible for the benefit will receive the benefit. Next slide. It also establishes a pilot program where low-income veterans who are eligible for the Beneficiary Travel program can receive 48 hours in advance, can receive reimbursement 48 hours in advance of their confined medical appointments. It established a pilot program that will reimburse eligible veterans for beneficiary travel to vet centers for mental health counseling, and establish a pilot program to expand public transportation to facilities that serve veterans. And if they get the public transportation program enacted into law, that would assist. I'm not sure how much our members will be able to use public transportation, but that will provide a great benefit to veterans, a resource to get to and from VA facilities using public transportation. Next slide. So we talked about resources. This is a link to the resource guide, and I'm gonna just ask Heather to click on a couple of the links, if that's okay. And we'll just show you what the links look like. So this is the Veterans Transportation location. So if you want to find where the services are in your area, you can click on the state. And this is Colorado, and it will provide you a list of all of the locations that offer the Veterans Transportation services. And so then you would go to their website, but if you need the transportation services, you're going to work through your local VA VTS program for that service. Click on the instructions on how to access beneficiary travel services, Heather, please. So once you go through this, it's going to provide you a recording step by step on how you access this service. So, you know, you shouldn't have any issues in trying to follow the instructions and filing the application online. But one point, remember, every time you travel for an appointment, you have to file a claim for that appointment. And also, the appointment has to be scheduled in advance. If it's scheduled in advance, VA will reimburse you for round trip to and from your home. And if it's not scheduled in advance and you come in unscheduled, you're an unscheduled walk-in, VA is only going to reimburse you one way from the medical center back home. That's next slide. So that concludes our formal presentation, and I'm going to turn it back over to Heather for the question and answer session.
Well, thank you, Roscoe, and thank you, Michael, for giving us that overview of the transportation programs that are available through VA to help veterans access healthcare. Certainly, we know access to transportation is an issue that many of our members face in a variety of contexts, and definitely within the healthcare system is another arena. One of the questions we had, and Michael, this may be something that you could address from your facility, is there was a question about why did VA take off of the computer that you sign into to be able to get travel? So the kiosk when you're arriving, it sounds like you used to have the ability to just do your beneficiary travel right there, and that was removed. Can you, Michael, or Roscoe respond to that?
I know it was removed from those kiosks. I don't know the exact answer why. I do know that those kiosks were temporarily not used during the pandemic due to, spreading of the virus. So those were closed. I'm not sure if that had anything to do with it, but I know you used to be able to claim your travel when you checked in for your appointment, and I do not know why the VA removed that.
I don't know, but we can look into it and we'll get you an answer to the question.
Great, thank you for that response. We had a question about can payments be made directly into the bank account for the beneficiary travel, since the VA already has the veteran's bank information. The veteran is saying they always just get a check in the mail. So any response about where we are, I guess, with direct deposit for beneficiary travel?
Yes, they can. VA no longer issues paper checks. That was a requirement by the Treasury Department to discontinue paper checks to all federal agencies. So now veterans have to have a bank account that the funds can be electronically transferred into. There are some exceptions to that rule. I don't remember all of the exceptions, but it's the main requirement is now veterans have to have a bank account in order to receive the benefit, unless they meet one of the exceptions.
Thanks, Roscoe. Michael, did you have any follow-up? Do you have veterans still receiving those paper checks?
Yes, there are exceptions. I don't know those, but I will point out that when you log into the beneficiary travel self-service system, you have like a profile you set up, and you have to associate your direct deposit account in there. It does not automatically use whatever you have set up for your VA benefits. For example, your pension or your disability compensation. So you do need to set up your direct deposit account individually in the travel system.
Great, thank you for that information. So we had a question, a veteran who is looking for some specific ride information where he lives, and we'll follow up with you, Dean, offline. But Roscoe or Michael, maybe you could go over again for me. If a veteran does need a ride, they're not, they're not able to maybe access the VA through a vehicle that they can use. What are the ways in which they can find out about rides that are available at their local VA medical center based on some of these programs?
So one, as I mentioned, VA offers special mode transportation, but that has to be medically indicated. So if your VA primary care doctor documents in your medical record that you require special mode transportation, and you're eligible for beneficiary travel, the beneficiary travel office will arrange for special mode transportation to come to your home, pick you up, and take you back home at VA expense.
And this does need to be pre-approved. Your primary care physician or therapist would put a consult in to get that approved ahead of time, unless it's an emergency situation. And then you have 72 hours to notify the VA about the travel afterwards, and you can file a claim.
Great, thank you for that feedback. Please put your questions in the Q&A box, and we will be happy to ask those of our NSO and also Government Relations Director. In the meantime, we did have a question about how to find the information using the PVA site. Michael, if you could maybe just describe for us again about how to find your NSO, and then I'll go over how to find this webinar once it's available.
Okay, you go to pva.org. In the top menu, you're going to scroll over Veterans Services and then scroll down to Find a National Service Officer. You click on that, it takes you to another page where you actually have to click on Find an NSO. It'll ask for your city. You type in your city, and then it's going to pull up a list of service officers and also the chapter and any local VA medical centers in your area.
Great, thank you, Michael. And this webinar will be available on the PVA website under the Veterans and Disability Advocacy tab under Veterans Issues. Conveniently, if you signed up for this webinar, it will also be sent directly to your email address, so you will get a link to the actual recording and the other information that's available. So you can stay tuned for that. We had a question about in the bit kind of a statement, and curious if we have a response here. In the process of travel, there is still a lot of confusion on how travel should be handled, and different departments will handle the travel forms. Others advise you apparently just to go to the internet. Others are still using the kiosk. So there's a variety of ways it sounds like you can try to get the beneficiary travel, I'm assuming, and other information, and this gets confusing to veterans. Is this something, Michael, that you're seeing at your VA as well, that there's a variety of different ways to kind of access the same thing?
This is kind of common with anything within the VHA. There's each facility kind of does their own thing a little differently. It's kind of frustrating, but yes, we do see a variety of different policies at each VA medical center across the country.
Gotcha. And how, Michael, do you suggest, what is the best way for veterans to try to navigate all these various, depending on which directions you go? Is it best just to listen to whatever the direction is of the local, part of the VA you're working with the NSO? What's the best way?
If it gets to be confusing and they're unsure, they should contact their NSO. Maybe we can reach out to leadership at that VA medical center and find a solid answer on what they should be doing, what their policy is at that specific facility.
Great, thanks, Michael. We had a question about the resource that's available through DAV. I know that they have vehicles and do provide a lot of transportation options that work for some veterans. So is that something either of you could comment a little bit more about?
Well, the limitation with DAV is that it's not wheelchair accessible. Their vans are not wheelchair accessible. So if you need to be transported via wheelchair, then they don't transport wheelchair veterans or wheelchairs. You're muted, Heather.
Checking into the chat box, I see that we had one question about disability ratings. So to access any of these programs, does having a rating 1 matter, and does the level of rating matter? So number one, do you need to be service connected? And if so, do you have to reach a certain level of service connected to access some of these transportation benefits?
Service connection is part of the eligibility criteria, but you don't have to be service connected. You can also receive Beneficiary Travel or VTS. If you are a non-service connected veteran, you're receiving a VA pension, or your income is below the maximum annual pension rate. So it's all, available not only to service-connected veterans, it's available to non-service connected veterans, but only if you meet the eligibility criteria that was described in the slide presentation. And also I mentioned that the statutory authority for beneficiary travel is Title 38 USC 111. So if you pull that up, you'll see what the statutory requirements for beneficiary travel is.
We had a question, Michael, this one might be for you. Can a spouse receive travel pay if the veteran is in the hospital or hospitalized, so that the spouse can get back and forth to the hospital?
Roscoe may be able to elaborate. I know they will provide travel reimbursement for caregiver if they're traveling with the veteran, if they need their caregiver to go with them. I don't know off the top of my head if a spouse can get travel if their spouse is in the hospital.
Under the beneficiary travel rules, if a veteran requires an attendant, and that has to be documented in their medical record that an attendant is required, then VA can reimburse that attendant for travel in accompanying and assisting the veteran.
Great, thank you. We had an ask to repeat the answer about taking the transportation form off of the kiosks when folks come into the medical center. Michael, if you could maybe just go over that again, please.
Yes, from my understanding, there's still some facilities using the kiosks for the travel claims. Most of them, I believe it was removed. I wasn't sure exactly why. We were going to look into it, but it might have had something to do with the pandemic, because those kiosks were all kind of shut down temporarily during the initial pandemic. So we're going to look into why, and if there's a question at your specific facility on how to go about, you're not sure if you should be using a kiosk or a form, then reach out to your NSO. We can probably contact the VA Medical Center and get you a solid answer from leadership on what you should be doing.
Great, thank you, Michael. So I don't see any further questions in our chat box or Q&A box. So great job on going through the issues today. Are there any final words of wisdom either one of our presenters would like to pass on to veterans who are looking into transportation and trying to address transportation challenges?
I'll just echo what Michael said during the Q&A session, that if you encounter any issues or problems and have questions, reach out to your NSO who can assist you in responding to whatever your questions about beneficiary travel and the Veterans Transportation Program, any questions you may have.
Great. Well, thank you, everyone, for attending today. I see we did have, we had one question I thought pop in, so I was checking to see where we were at with that. Mark Rosensteel, if you could maybe type in your question again. I'm not sure where you're going, and I'd like to answer it, but I will do some wrap up, and if you could type it in. If you don't get back to us, please follow up with us afterwards. But we will have this information available on the PVA website, including the links to the various parts of the transportation program. So whether it's beneficiary travel, the Veterans Transportation Service, the highly rural grants, and you're trying to figure out what options are available in my community, those links will be a great place to start. You can also, as was said today many times, your NSO is a great resource who can assist you in trying to be able to figure out, if you're having problems, figuring out how do I get my benefit, or how do I apply for it, or am I even eligible? That's something that they can help you kind of work through. And remember that there are lots of resources available, including those community resources that we talked about today. And please know that PVA is continuing to work on all of these issues to try to improve access to transportation for veterans and other people with disabilities in a variety of areas. So we want to thank you for dialing in to today's webinar. I want to thank our two panelists for all of their work today. And we look forward to seeing you on one of our webinars sometime in the new year. Thanks, everyone.